After years of discussion about what to do to help the homeless population in Bergen County, a new facility has been built. Up next on Inside Bergen, the opening of the Bergen County Housing, Health, and Human Services Center. Welcome to Inside Bergen. I'm your host, Bergen County Executive Dennis McNerney. October 1st, 2009, Bergen County opened the doors to a new facility. One that not only provides shelter to those who are homeless, but gives them hope that they can change their lives permanently. This new facility is called the Bergen Housing, Health, and Human Services Center. And joining me today on Inside Bergen is Freeholder Vice Chairwoman Elizabeth Calabrese. Welcome, Freeholder.
Thank you, County Executive. I appreciate the invitation to co-host today on a topic that's very important and very close to my heart.
Great. And our first guest is the Director of the Center for Housing, Health, and Human Services, Julia Orlando. Welcome.
Thank you. I'm so glad to be here today with you.
All right. The 3H Center, as we're now calling it, on River Street, is really something much more than a traditional center. Is that correct?
That's correct. What's wonderful about this facility is that it's operating as a one-stop. So individuals can come in who need shelter. They can come in and get something to eat. They can get clean clothes, a shower, use the phone, meet with the case manager, and most importantly, access services, especially to get housing and get out of homelessness.
Julia, you don't call the people that come to the center, you refer to them as clients or guests. Yes. Rather than clients. Why is that?
It's very important that we think of them as guests and that we treat them as guests, because this indicates that we have an approach that's of hospitality and of welcoming. I think what's very difficult for persons who are homeless is there are many places that they're not feeling welcomed. And the first step in helping people is that they feel welcomed. So by calling them guests, we give them a sense of hospitality and welcome and belonging when they come in. The second part of that that's important is that this is not permanent housing. They're not residents. And so when we call them guests, there's also a notion that it's only for a temporary period of time until we find them housing.
I understand we have some video that maybe you can help us through. And
sure.
What is really the overall message that's being given to these centers' guests?
I think the overall message is really one of hope, and that we can help people find their way out of homelessness and lead them to housing. That's the most important thing. And we also recognize that that's not easy. And what we tell people is that we know it's going to be difficult at times and you're going to need assistance, but that if you come to the center, all of those pieces can come together, and there's going to be someone there to help them every step of the way.
That's great. You know, people should know that the Bergen County doesn't run this facility on its own. I understand that there are several nonprofit organizations that help along the way. Can you tell us about that?
Yes, absolutely. We have wonderful partners. We have Christchurch Community Development Corporation. They are actually managing the shelter and the Next Step program, which is pretty much a drop-in center where people can come every day. We also have Care Plus of New Jersey, and they are providing case management. They're helping people from shelter into housing and making sure that not only that they obtain the housing, but that they're secure in the housing. Friendship House is another partner. They provide our breakfast and our lunch, and they also provide our maintenance in the building. In addition to that is the Housing Authority. And the Housing Authority, of which I'm an employee of the Housing Authority, we manage the facility, all of the grounds of the facility, and also the actual program. And the Housing Authority is also responsible for the important vouchers that we're getting that are allowing us to get people into housing.
Now, since this shelter is open, you've really witnessed a lot of miracles. How many of those vouchers have been awarded into permanent housing?
I am so pleased to say that by the end of this week, we will have housed 40 individuals
in just a couple months.
In just a couple months.
That's just an amazing accomplishment. Do you believe that when people see other guests receiving these vouchers, that it gives them hope?
Oh, absolutely. We hear from many people that they have been waiting a very long time and that they were beginning to give up hope, or they didn't think that they would be able to get into housing for various reasons. We have a community meeting every 2 weeks, and what's really wonderful is the first thing we do every meeting is we have someone hold up who has keys. Wow. And when people see that and they see that this can happen for them, especially if they've known them for a while and they see the looks on their faces, it's just wonderful. And it's also wonderful is that they come back. So even though they go into the housing, they'll come back, they'll visit, they'll tell other people, and that good feeling, persists from one person to the next.
And I know the Freeholder Board and Chairman Jim Carroll are big supporters of this, and but we're actually using state and federal grants that are helping the operating cost.
Yes, I have to say that we're so grateful because due to the Department of Human Services at the county and community development has just allowed us to do all these wonderful things through the generosity of these grants. It is miraculous that all these have come together in addition with the vouchers from the Housing Authority. So between the grants and the vouchers and the expertise of the staff, it's a wonderful, wonderful experience for people.
Julia, people in Bergen County seem to feel that this is not a county issue, homelessness, or that there are no poor in Bergen County. I, for one, know for a fact, and I'm sure you do too, that homelessness affects families as well as individuals.
Absolutely. I was actually just reading yesterday that we've now seen a 56% increase in family homelessness in suburban areas, which is absolutely what we're seeing. I'm getting many more calls about family homelessness. We're seeing more families actually eating in the shelter and also coming in for the stimulus funds, the assistance in eviction prevention. We're seeing many more people coming in. So it very much is an issue that we're battling, but I think very well given the resources that we have right now to deal with that.
Sounds like this is a great cooperative effort
Yes.
at a very opportune time.
Yes, I agree.
Can you tell us about the facility itself in terms of, you said meals? I know I've been there on a number of occasions. There are meals available for those who can walk in and for those who are staying there. Right?
Absolutely. We have 3 meals a day. The breakfast is for the guests that are staying in the facility, of which we have 90 now. Lunch is a bag lunch, which is great because people who are working can come in, get the lunch, take it with them. They don't have to stay in the facility. And then dinner, which is expertly provided by the Interreligious Fellowship, which are 300 churches and synagogues in our county, and they do this unbelievable meal every evening. And we're serving upwards of 125 to 150 people in the evening who are coming in, and it's open to anyone who needs those services.
Now, I know you've been active in working for the homeless. What have you done in the past in terms of the experience you had in the past and actually the new facility?
Well, I worked in New York City for 20 years. My experience has been in housing with persons with serious mental illness and substance abuse, people who are also chronically homeless. So in terms of the population, people that I've worked with is very similar. It is such a joy for me to be working here in this facility because I'm a county resident. So it's always been very close to my heart, not only to do the work that I feel very passionate about, but also to be doing it here in the county that I live.
You know, when I was at the center just a week or two ago, I saw private industries or nonprofit organizations or philanthropic organizations making donations to the center. And I know that there's a Hackensack business owner who made a significant donation. Could you tell us a little bit about that partnership?
Absolutely. Mr. Sohm from Sohm Uniform called me one day and said, you know, what do you need? What do you need? What can I do for you? We're so pleased to what you're doing down there. And I said, well, you know, we could use, we need clothes. People come in from the street, they'll take a shower, but they need clean clothes to put on. And he donated, I think it was upwards of $7,000 worth of scrubs and uniforms that people could just comfortably put on, all different colors and sizes. And it's wonderful because we're using them every day. But it's also wonderful for me to see that the business district is also connecting with us because this issue of homelessness affects all of us who live in the county, who work in the county. So it's just been wonderful to see people coming together. And I get many calls during the week, can I come down? And many of them are in real estate and other business owners. I had someone call the other day from a delicatessen. We'd like to donate something on Christmas. We just received a large shipment of coats. It's just amazing how people really do want to help and are reaching out.
Yeah.
And now this is a center for men and women,
Yes.
and it's separate as well.
Yes.
It's by floor, actually, right, in terms of...
Correct. The upstairs area is male and female. We have 62 people upstairs. One side is male, one side is female. And then downstairs in the overflow area, that is a co-ed area, but we do actually keep them kind of on one side and another side as best we can.
All right. Well, thank you, Julia Orlando, the Director of Bergen County Housing, Health, and Human Services, for joining us on Inside Bergen. And we'll be back with much more, so stay with us.
Thank you.
Ever think about who will answer your 911 call in a medical emergency? Many times, the people who respond are no strangers. They're your neighbors, friends, relatives, and coworkers. They're dedicated to helping people. They respond at all hours, in all kinds of weather, and are trained to handle any emergency.
They're also volunteers. They could be you.
To find out how you can join the thousands of other EMS volunteers, contact the Bergen County Law and Public Safety Institute. If you don't, who will?
Hey, Zachary.
Ready?
You looking good? Great hit.
The odds of a child becoming a professional athlete? 1 in 16,000. The odds of a child being diagnosed with autism? 1 in 150. You know the odds of autism. Now learn the signs. Go to autismspeaks.org.
Hi, I'm Bergen County Executive Dennis McNerney. In these tough economic times, Bergen County can help you. Programs such as free community transportation, Meals on Wheels for seniors and the disabled, job training, counseling through our one-stop career center, veteran services, an office for children, home buying assistance, and senior services. All geared to ensure the well-being of your family and to enhance our quality of life here in Bergen. So come on in, our doors are always open. Bergen County, serving you. Welcome back to Inside Bergen. The Bergen County Housing, Health, and Human Services Center is much more than a shelter. Here to talk about the facility and the concept behind it is Clark LaMandola. He's the consultant who worked on the center's plans, and we're glad you can join us today, Clark.
Well, thanks for inviting me.
Nice to see you again, Clark. The new center was built around the Housing First model. Could you explain that to us?
Yes, the model is very straightforward. It's based on the premise that if you can place a person in housing first and then provide the wraparound services that are needed to really provide stability for them, that you'll have a much more successful approach to eliminating homelessness than you would if you merely took them into the shelters and warehoused them.
Makes sense.
Now, this actual design, why the Housing First model, why is it so important, what you just explained?
Well, it's the core of everything, Dennis, because if you can provide a platform where the services are brought together and into a kind of a one-stop environment, and you surround them and make that environment a productive environment, one that's filled with hope, as was discussed earlier by Julia, you have a much better chance of making the placement a permanent one. Remember that when they enter this area, our objective is to place them into housing as soon as we can and bring the services with them to where they're living, so that we're creating an environment in which stability, hope, and a desire to become productive again is what's focused on. And that's what makes the difference. Also, there was a change in federal policy that occurred during your administration. we had started the process under your leadership of building the shelter on the site, and federal guidelines were modified to really require us to build a center and build a system that brought the services together.
Sounds like we're on our way to fulfilling our vision. I'd like you to tell us about the previous provisions for the homeless in Bergen County before the 3H Center was even thought about.
Okay, well, at one point, of course, we did have several shelters that were being managed and funded by the center, by the county, excuse me. The most prominent one was, of course, the one at Kansas Street, which has always been designed to be.
And here it is, that's the old one.
Yes, there it is. It was designed to be a temporary shelter, and there were approximately 40 people staying in the shelter. The principal difference, of course, other than the quality of what we have today, is that there were no services really truly available to them on site. And as a consequence, we would have been inhibited from really performing what needs to be performed in order to move them into housing rapidly. So as a consequence, I think what we saw here with the former shelters were a best effort to try and provide some modicum of care for folks who didn't have any other resource. Now, under the new approach, the objective is to place them into housing, which is really a move towards solution rather than warehousing.
And for so many years, the homeless were just really seemed to be, this is an accepted way of life. So what are really the most important goals of the center in terms of just eliminating the chronic illness, situation of homelessness?
Well, I think the most important change that's happened, Dennis, is a change in objective. Our objective prior to Housing First was to provide shelter. And so shelter was the end. That was it. Now our objective is to place them into housing. And if the theory works, and we've seen evidence that it works very well in cities and suburban communities throughout the United States, we should be able to eliminate chronic homelessness and be able to deal more effectively with what we're facing today, and we're facing it everywhere in the United States, and that is the impact of the economy on people's lives. And so what we have is acute types, acute events that lead to homelessness, loss of job, loss of a stable family. And the center is designed to relate to those types of problems and try to prevent the homelessness from occurring using a combination of federal and state funds.
You know, Clark, one other thing that impressed me is that there are so many services that are offered at the center now. How important is it for the guests to have that one-stop facility?
I think that other than the objective of placing them in housing, the objective of having the services in one place to create that helping environment is almost equal in importance. And I think what's so encouraging here is that the objective of collaboration is being met. This is shared service in capital letters. There's major departments of the county. There's the County Housing Authority. There are the major institutions in the nonprofit community. And there are volunteers who are working collaboratively in that center to deliver the service. Of course, the challenge is, how do you make that collaboration work? And how do you keep all those wheels in motion and people, you know, moving along properly? And that, of course, is Julia's responsibility, and she's doing a great job of it. A masterstroke, I think, was bringing together the Housing Authority with the County of Bergen's Community Development, Human Services, and Health Department, so that what we really have is we have all the departments working collaboratively to create the framework that the nonprofits can come into and work in. So Care Plus, Friendship House, and Comp Care through its PATH program, and Christ Church are now all together in one place doing the job that needs to be done.
There's a lot of services you've mentioned, and there's a lot of different members of the community that are there. One that we talked about is the veterans. Actually, past veterans and even maybe some coming right from the Iraq-Afghanistan situation. How is the county helping them out there at the One Stop?
Well, the county does have a Department of Veteran Services, and they were among the first who said we have to be there. And I think it's sometimes lost on folks that we do have and have had for some time an issue in which veterans, because of the problems that they've faced serving our country, come back to homelessness. They come back with problems that need to be resolved: drug abuse, alcoholism, post-traumatic stress syndromes. And so this center is designed to relate to that, and it's the folks from the county department who are coming over using the flexible office space that's been designed for them to use, and they're there at least once a week, I think sometimes twice a week, to meet with veterans and help them get access to the services that veterans are entitled to.
Sounds like a great cooperative effort.
Yeah,
Speaking of cooperation, I understand that the United Way is a great resource for the center as well.
Well, I'm glad you mentioned that, because without the United Way's support at the outset, we would not have been able to get started as effectively as we could have. It was their seed money and their willingness to serve as chair of your 10-year homelessness or your housing development plan, and to provide some leadership to the Housing Works project, which was our demonstration effort that we could actually do this, that I think made a big difference. So they deserve a lot of credit for kickstarting us and actually for being there with us still today. Thank you for mentioning that.
Now, over time, the concept really is an actual savings of money because of really trying to take care of the issue of homelessness versus what was in the past, which was a temporary shelter. Can you elaborate on that more? Like, if we take care of an individual or a number of guests now, the society in general longer will have a cost savings.
Well, the logic is if we can eliminate homelessness, we're going to eliminate all the overuse of the emergency services and basic services that we have, Dennis. And I did an awful lot of research on this when I was developing the proposal for your consideration. And basically, what I discovered is that in every location around the country where Housing First was put in place and was properly managed, there was a reduction in cost of emergency services, sometimes literally 25 to 35% reductions in cost. Now, when you look at it, and sometimes we don't think of these things, the use of the emergency room, the use of the jail, where often the jail becomes the only resource that a homeless person has access to, the use of emergency services like police. These get overused when you allow homelessness to persist and to become unserved in the community. So placing them in a home is less expensive, and in the long run is going to reduce the cost for all of us, because we're paying for this through our tax dollars.
There were so many things in the center that impressed me, but one of them that I noticed particularly is that the guests are encouraged to keep busy during the day. Televisions are shut down during the day. There's no one hanging out. Right. They're encouraged to be proactive about finding a job or getting the resources to get them back on the road to self-sufficiency. Where did this model or idea generate?
Well, Julia calls this tough love. Okay, so maybe I should call it that too. But when we designed the center, and Julia was helpful in having us think this through correctly, it was our feeling, and I believe we were supported by most of the social work community, that you needed to have a tough love approach. This was not about come in and have a cup of coffee and accept your way of life. We're going to try and help you. You're going to have to make a decision to be helped. So when they come into the drop-in center, that's not just to keep them out of the cold. Yes, they can come out of the cold, but the objective there is to get them engaged with the services that are available to them at the center, to help them find a job, to help them get the health care they need, and get them into a home. That's what the most important thing is.
What's the future of the center itself? Where do you see in 10 years in terms of growth?
Well, if I were a dyed-in-the-wool idealist, I'd want to be.
Need it.
I'd want to say to you, well, it's going to be empty, and we can use it for another purpose. But I think what we're doing here is breaking good ground. We're establishing a change in the culture of the helping community. This is a major collaborative effort. And the agencies of the community and the departments of the public sector and government are working together more intimately than they ever did in the past, which means that they're lending support to one another and they're creating a new way of delivering care. And they're delivering it in one site. So I think the long-term goal here is to create a model that possibly could be emulated in micro sizes in other areas of Bergen County where needed, with combinations of services in those locations, so that we reduce the pressure on our transportation grid and we increase the capacity of our people to get the services that they need.
The center opened in October. What are the greatest changes that you have seen since the center, as it referred to Hackensack or the surrounding areas?
I believe that what I've found to be the biggest change is a change in hope. When I go to the center, I see people who are being helped and being animated and treated with the respect that I would hope we all treat one another with. And the fact that the center has been able to place 38 people in permanent housing in such a short period of time tells me that we're on the right track and we can get the job done.
Great.
Well, thank you again. I want to thank you, of course. We're out of time, but I just want to thank our guest, Julia Orlando, the Director for the Bergen County Housing, Health, and Human Services Center, and Clark Lamondola, the consultant who helped make this important project happen. I also want to thank my co-host, freeholder Elizabeth Calabrese. The Bergen County Housing, Health, and Human Services Center is an important initiative for my administration, and I'm very proud of the center and look forward to hearing more about the positive changes it brings to the many people of Bergen County. Thank you again for watching this edition of Inside Bergen. We'll see you next time.